So my sister and I did arrive late on 11/11 to Alabama, but luckily my appointment was not until 2 p.m. on 11/12. We arrived at the chronic illness clinic through MedHelp. And so there was an array of tests, which was a chest x-ray, not terrible, but the pulmonary function test was unpleasant, to say the least. I almost passed out a couple times, and the gentleman had to hold me in my chair. They generally do a abdominal CT with contrast, but since I had just had that the previous month, he wanted me to just send him the results so I didn't have to have more contrast than necessary. And the reason they are looking at the abdominal CT with contrast is to determine if you have compression in your iliac vein or not. So they also ended up taking 24 vials of blood, which was a lot. One of the tests that they did do is they look at your blood under a microscope to see how much clots, microclots, that you have in it. And I ended up having 3.5, which is a significant amount because it goes up to 4 on their scale. So because I had that, I was diagnosed with post-acute COVID-19 coagulation and fibrolysis venous disease. And the treatment for that was 81 milligrams of aspirin twice a day, Plavix 75 milligrams half tab daily, and of course Eliquis 2.5 milligrams twice a day. So that's the standard triple anticoagulant therapy that pretty much everybody gets when they have the microclots. Now, I was also diagnosed with mast cell activation disorder, and since I was having some issues with insomnia for the last week and a half and only had a couple hours sleep, if that, for a week, he gave me a compounded medication specifically for what I was going through for the mast cell activation disorder, along with Pepcid 40 milligrams twice a day, and then quercetin 500 milligrams twice a day. And then he showed me the PowerPoint, which I only kind of got about half of with my lack of sleep, and we'll go over the rest next time.